Bismillahirrahmanirrahim. Assalamu alaikum to all my viewers and students. As you all know that we have started the series of gastrointestinal tract, and we have already completed the classification and the detailed topics of the antacids and H2 receptor antagonists. And here we are with the proton pump inhibitors. And in today's lecture, we will discuss the clinical points of the proton pump inhibitors, which is very important. And you also must be know that we before discussing the clinical point, I always discuss and clarify the main mechanism of every class. So before going to the therapeutic uses and the clinical points, we will first discuss what is the mechanism of the proton pump inhibitors and in which nature it is developed. It is a prodrug, which is very important thing to know about. It is a prodrug and it developed with the acid resistant coating. Now why it is developed with the acid resistant coating? Because it get damaged by the acid of the stomach. So it is the acid labile substance. It is an acid labile proton pump inhibitor in which omeprazole, rabeprazole, pantoprazole are included. These all are the acid labile substances. So they get damaged by the acids of the stomach. So they are formulated as a prodrug with the acid resistant enteric coating. This enteric coating removed in the alkalinic duodenum and it get absorbed there. So when it get absorbed there, as you all know that when the substance, when the food item or when anything that we eat get absorbed from the duodenum, it enters in the circulation. It enters in the main circulation, and the main circulation then liver, and from the liver it distributed throughout your body. So it also follows the same pathway and it distributed in our body, and as its action is in our gastric parietal cell. So when the blood supply reaches the parietal cell, gastric parietal cell, it enters the gastric parietal cell and there it converted to the active drug. Okay, so this is the process by which it get converted into the active drug. Now in the gastric parietal cell, it forms the stable covalent bond, and you all know that covalent bond is the strongest bond. It forms a stable covalent bond with the hydrogen potassium ATPase pump, which is involved in the secretion of the hydrogen ion, and this hydrogen ion when get combined with the chloride forms the HCl, which is the acid of the stomach. So by this pathway it enters your circulation and it absorbs in your circulation, and then from the circulation it get entered into the gastric parietal cell. It transported to the gastric parietal cell and there it's converted to the active drug because it is a prodrug. So first the coating removed, it get absorbed and enter the circulation, from the circulation to the parietal cell to the converted to the active drug, and then from the being converted to the active drug it forms the stable bond with the hydrogen potassium ATPase enzyme. It combines with the enzyme. Okay, so the active components are written here. Sulfenic acid and sulfonamides are the cations in which it is formed, and the main ingredient that forms the stable covalent bond with the hydrogen potassium ATPase enzyme or the pump is the sulfonamide. Okay, so the mechanism must be clear. I hope it is clear to you now. Okay, so now moves to what it takes 18 hours for the enzyme to be resynthesized, and the acid secretion during this time is inhibited. So when it get bonded covalently with the proton pump inhibitor, the enzymes required to be resynthesized. It does not get separated, it requires to be resynthesized. So the body resynthesized it, and the duration in which it get resynthesized is the 18 hours. Okay, so this is the usually the time duration, and that's why they are very effective for the long-term suppression of the acid secretion. Secondly, they inhibit both basal and the stimulated secretion at the standard dose by more than 90%. And you all know that the basal is the non-stimulated, and stimulated means that when you eat something, when you eat food, and the acid secretion gets increases. So this is the stimulated secretion, and the basal secretion is that secretion when you have not taken any meal or any food, and the normal secretion in the body, the normal HCl in the body or in the stomach is the basal HCl. Okay, one very important point about this I will discuss in the kinetics. Okay, now the combination product of the omeprazole and sodium bicarbonate. You all know sodium bicarbonate is an antacid. Sodium bicarbonate and the omeprazole, the combination product, is available in the combination product, and it has a better absorption and available as a OTC and prescription, and it is taken before meal. And why it is taken before meal, I will discuss in the kinetics. Now first move towards the therapeutic uses. It is used in the GERD and the other disorders related to this dyspepsia type of condition. Proton pump are preferred drugs for the stress ulcer treatment, for the prophylaxis and the treatment of the GERD, active duodenal ulcer, erosive esophagitis, and pathologic hypersecretory condition, which includes Zollinger-Ellison syndrome. And now, what is Zollinger-Ellison syndrome? It is the syndrome that is due to the hypersecretion of the ACL by the tumor cell. So the tumor cell developed in your stomach, and it causes the hypersecretion of the acid. So for all these conditions, proton pump inhibitors are used. GERD is the gastroesophageal reflux disease, and erosive esophagitis, which is also the problem of the esophagus. Active duodenal ulcer, you all know, as the name indicate, it is the ulcer of the duodenum. And the stress ulcer, which is due to the lying for the long period of the time. This is more commonly occur in the patient with the who are admitted to the ICU. Okay, so what are the doses for this for all these condition? Proton pump inhibitors are usually taken once daily. These are partially effective for the GERD. BID proton pump inhibitor or the proton pump inhibitors in the morning and H2 receptors at the bedtime improve the symptoms. So if you take once daily, they are partially effective for the gastroesophageal reflux disease. However, you can also take proton pump inhibitor twice daily, or you can rather go for the proton pump inhibitor in the morning and H2 receptor antagonist at the bedtime. Now, why there is such a long duration difference between these two drugs, that one is taken in the morning and the other is taken at the bedtime? Because H2 receptors proton pump inhibitor requires the proton pump to be in the active state. Proton pump inhibitors requires the proton pump to be in the active state, while the H2 receptor antagonist decreases the activity of the proton pump. So when, for example, when you have already first taken H2 receptor antagonist in the morning, for example, you have taken H2 receptor antagonist in the morning, the activity of the proton pump will decreases. And when the proton pump inhibitors, you take, for example, omeprazole in the night time, the pump will not be in the active state, and it requires the pump to be in the active state to proper functioning, to act properly. Proton pump inhibitors requires the proton pump to be in the active state. So when you have already taken H2 receptor antagonist and it has already decreased the activity of the proton pump, the efficacy of the proton pump inhibitor or the omeprazole will decreases. So that's why proton pump inhibitor are taken in the morning, and H2 receptor antagonists are taken at the bedtime. So this is very important clinical point of view. When you are going to give both of these drugs, there should be the time difference, there should be the gap of the more than 10 to 12 hours, or rather you should prefer to take the proton pump inhibitor in the morning and H2 receptor antagonist at the bedtime. Okay, so I hope it is clear to you. Now comes to what the other point. Proton pump inhibitor decreases the risk of the bleeding from the aspirin ulcers and the other NSAID. As you all know that NSAIDs causes the ulcers, and it obviously lead to the bleeding. So proton pump inhibitor also decreases this risk and also used to treat and prevent the NSAID induced ulcer. Okay, so these points are, I hope, are clear to you now. Now moves toward one of the most important area of use of the proton pump inhibitors, which is the H. pylori ulcers. H. pylori ulcer. Now what is the H. pylori ulcers? H. pylori ulcer are caused by the H. pylori microorganism, which is the gram-negative bacillus. It causes the Now what is the mechanism and how it treats the H. pylori ulcer? Number 1, proton pump inhibitor has minor antimicrobial activity. Secondly, it increases the gastric intragastric pH, which leads to the healing of ulcer. Now what is the treatment regime? There are the two type of the treatment regimes. Number one is the triple therapy regime, which consists of the 14 days treatment. Proton pump inhibitors are given twice daily, clarithromycin 500 mg given twice daily, and amoxicillin 1 gram twice daily. Or in the case of the amoxicillin or penicillin allergy, you can give metronidazole 500 mg twice daily. So this is the very important regime. Now repeat the regime with me. Proton pump inhibitors twice daily, clarithromycin 500 mg twice daily, and amoxicillin twice daily, 1 gram twice daily. Or in the case of the amoxicillin allergy, metronidazole 500 mg or the 400 mg. It is, I think, it is available in the 400 mg potency, so it is given twice daily. Okay. Now after the completion of this therapy, proton pump inhibitor, this therapy should consist of the 14 days, should be continued for the 14 days, and after the completion of this therapy, the proton pump inhibitor still continued for the 4 to 6 weeks to ensure complete healing. Now one very important point is that people used to give or use augmentin instead of the amoxicillin. However, this should not be your practice, because augmentin has more side effect because of the presence of the clavulanic acid. It can cause the diarrhea, it can cause the stomach upset, clavulanic acid. However, although it broadens the spectrum of the amoxicillin, but as it has a side effect and we cannot afford any GIT side effect in this case, so we will go for the amoxicillin. And in the case of amoxicillin allergy, we will move toward the metronidazole. So there are the two antibiotics and one proton pump inhibitor. As I have told you in the previous lecture of the H3 receptor antagonist, that this therapy consists of the proton pump inhibitor and the two antibiotics. Now comes to what this was the triple therapy, and this is also known as a triple therapy, consists of the 14 days. Now comes toward the sequential treatment. Sequential treatment consists of the 10 days, and as the name indicates, it consists of the sequences of the drugs. For the day 1 to day 5, proton pump inhibitor twice daily and amoxicillin 1 gram twice daily is given. From day 6 to day 10, 5 additional days of the proton pump inhibitor twice daily, like proton pump inhibitor, should be continued for another 5 days. Now the amoxicillin is replaced by the clarithromycin 500 mg twice daily and tinidazole 500 mg twice daily. So this time the one antibiotic is stopped, discontinues, and the two other antibiotics are added. So this overall sequential treatment should consist of the 3 antibiotics. Okay, so I hope it is clear to you, and this is the most important clinical points of the proton pump inhibitors. Other than these, we will move towards the kinetics, and these are also very important to know about the kinetics of the proton pump inhibitors. Okay, now what is the kinetics? Kinetics, as we all know, it is orally effective. Proton pump inhibitors should be administered 30 to 60 minutes before breakfast or the largest meal. Now, why they are administered 30 to 60 minutes before breakfast? Because it requires to be first absorbed into the circulation. Okay, it does not act locally like the antacids. Antacid act locally and involves the neutralization process, but it does not involve the neutralization process, and it does not act locally. It has to be first moved to the duodenum, then absorbed to the body circulation, then circulated in the body, and then comes toward the stomach and the parietal cell, and parietal cell and in the parietal cell it get activated. Now this requires to be administered this drugs 30 to 60 minutes before breakfast. And now why before breakfast, why before meal? Because when you take the meals, your gastric parietal cell or the H2 receptor hydrogen potassium ATPase pump is more active when you eat meal. So if you have already taken the inhibitor of this pump, it will not cause the release of that much acid as it going to be in the absence of that drug. So I hope it is clear to you why it is taken before meal. So if anyone asks you, you should have the logic that it has to be absorbed first. And why it does not act locally, why it does not get absorbed at the stomach? Because there must be little bit absorption occur at the stomach because it is an acid labile substance and it has indirect coated on it, which get dissolved only in the alkalinic medium, and it is acid labile, so it will instead of if you give without it indirect coated, it will destroy itself. Instead of working for our body, it will destroy itself without indirect coated, if you give without indirect coated. Okay, so the half-life is the fewer, however it has a long duration of the action because of the covalent bond it formed with the hydrogen potassium ATPase enzyme. So it is very important because the covalent bond formed, it has a long duration, however its half-life is small, of 1 to 1.5 hour. Now one very important drug in this class is the dexlansoprazole. It has a dual delayed release formulation and can be taken regardless of the food because it has a delayed release action. Okay, and it will release over the large period of the time. Now comes to what the availability. Esomeprazole, lansoprazole and pantoprazole are available as a IV, and you can remember it as a PEL IV. PEL is a company of the refrigerators, so PEL IV. Esomeprazole, lansoprazole and pantoprazole are available as a IV. Now comes to what the side effects. The adverse drug reactions are extremely important and extremely powerful of these drugs. Omeprazole and esomeprazole, these two drugs, not the whole class, omeprazole and esomeprazole decrease the effectiveness of the clopidogrel as they inhibit the cytochrome 2C19. Now when it inhibits the 2C19, so what will happen? Now first understand the clopidogrel mechanism. Clopidogrel has to convert it to its active form by the metabolism. When it gets metabolized, it converts to its active form and it will be metabolized by the cytochrome 2C19. So when this enzyme is inhibited, it will not convert to its active metabolite, and so the effect will not produce. And it is a blood thinner anticoagulant, so it will not cause its action and it can increase. So those patients that require its action to be on time, they have the high risk of the cardiovascular events. So this is the point that must be remembered. You should not give omeprazole and esomeprazole with the clopidogrel or any formulation or any drug that includes the clopidogrel. For example, clopidogrel and the aspirin are formulated most commonly. So you should have a check on these drugs, as they should not be co-administered at any cost. Now the other adverse effect is the fracture. Why it causes the fracture? Because number one, it inhibits the calcium absorption. Second, it decreases the absorption of the vitamin B12. Vitamin B12 is very important for your nerve functioning, for your proper body functioning, and especially the nerve functioning. And why it inhibits the vitamin B12 level? Because it is the acid because it increases the level, it increases the pH. Proton pump inhibitors increases the pH of your stomach, while the vitamin B12 requires the acidic environment for its absorption, so it does not absorb when you are taking the proton pump inhibitors. So number one, your nerve functioning decreases. Secondly, it impairs the calcium carbonate absorption, so your calcium will also not absorb, because it also requires the less pH. Impaired absorption due to the increase in the pH, while it requires the low pH to get absorbed. So both these important elements, vitamins, get decreased in the body, and it can cause the fracture and the osteoporosis. The chances of the osteoporosis get increased when you are taking the proton pump inhibitor for the long duration of the time. Okay, now what is the another important thing is that you can take calcium citrate alternative for the supplementation, because calcium carbonate usually not absorbed when you are taking the proton pump inhibitors, so you can give the calcium citrate. Calcium citrate is present in the sachets named as Opsical. This is also very running item, and you can take calcium citrate in this form. Another side effect of this drug is the diarrhea and the Clostridium difficile colitis. So the patient should discontinue the proton pump inhibitors at the time of the diarrhea. Okay, another important point, it has a 6 side effects, and all these side effects are very important and are different from the side effects of the other drugs. Not like the nausea, vomiting, diarrhea, confusion, dizziness, which are the most common side effects, or the GIT upset. It has different type of the side effect. Number one, decreases the effectiveness of the clopidogrel. Second, fracture. Third, vitamin B12 deficiency. So you should give the patient to the who are taking the proton pump inhibitors, you should give the vitamin B12 at the large time intervals. ठीक है ना, given at the large time interval. Secondly, you should give calcium citrate supplement. Thirdly, you should remember that it can cause hypomagnesemia, which increases the risk of the pneumonia. So when you are taking any remedy for treating the symptom, you should remember that don't go for the extreme option. This is proton pump inhibitors are considered to be the most strongest among the all the ACE suppressing class. So if you are careful about your drugs that you are going to use for the long term basis, because it has a lot of side effects. So this is all about the proton pump inhibitors. If you have any query, any question regarding this, you can ask me in the comment box or contact me through the Facebook page. So don't forget to subscribe my channel and share it with your friends. Until next video, Allah Hafiz.